Hey everyone, we're going to give the audience a couple of moments here to filter in from the waiting room. This is Catherine Small from the Healy Center at Mass General Hospital in Boston. And we've got a pretty good geographic spread on the call. So we have two guest speakers today, one from New Hampshire and one from Arizona. So lots of states here on the call today, and we can head to the next slide. And I'm going to hand things over. So Dr. Mark Garret will be presenting about the All ALS study and Prevent ALS specifically. And he's backed by Myah Stone, who's the patient navigator, one of the patient navigators for the trial. So I'll hand it over to you, Dr. Garret.
Perfect. Thanks so much, Catherine. And thank you for everyone kind of joining us today for the All ALS community webinar. So as Catherine mentions, I'm Mark Garret. I'm an ALS neurologist and clinical researcher up at Dartmouth Hitchcock Medical Center in New Hampshire. And I'm one of the kind of main investigators for the All ALS study and really worked very closely on the design and implementation of this study called Prevent ALS, which we'll talk a little bit about today. So we can move on to the next slide. So really, I wanted to give some brief updates, primarily focus on PREVENT, but as you all may be aware, All ALS really has two primary studies, PREVENT and ASSESS. So the ASSESS study follows people who are currently living with ALS, as well as healthy individuals without ALS to help serve as kind of healthy controls. So in about 10 to 15% of people with ALS, we can identify a genetic change that causes disease, and these changes may be passed down in families, resulting in families in which multiple people end up developing ALS. Um, Clinicians and researchers often refer to this as either genetic ALS or sometimes familial ALS. In addition to ALS, some of these genetic changes can also cause a form of dementia that we call frontotemporal dementia, or FTD. The most common of these gene mutations are the C9orf72 and the SOD1 genes. So the Prevent ALS is really focused on following healthy individuals who don't currently have ALS or FTD, and they are close family members of someone who has been diagnosed with a genetic form of ALS or FTD, or are known to be a carrier for one of these gene mutations. Prevent also follows people and enrolls people who are already known to carry a genetic change in a gene like C9 or SOD1, which may someday cause ALS or FTD. As a part of participating in the study, people who come from these families and may be genetically at risk for developing ALS or FTD can opt to talk with a genetic counselor to discuss whether they would like to undergo genetic testing for ALS genes, which is done confidentially through the PREVENT study. And through that process, they can determine whether they actually carry one of these ALS genes and may be at risk for this disease themselves. Really, the central goal of the study is to help us learn more about the very earliest changes of ALS, including potentially changes that could be detected even prior to developing symptoms of ALS or FTD. And this is really crucial in thinking about how we could help diagnose ALS at earlier stages, as well as potentially move to a future where we have clinical trials or treatments that aim to actually prevent people from developing ALS. So what does this look like for people who are participating? So people who are in PREVENT have one in-person visit every year with 2 additional remote visits in between those annual in-person visits. During these in-person visits, the study team will collect blood, they perform a neurological examination, measure your muscle strength, perform cognitive testing. There's also an option for participants to undergo a lumbar puncture that allows the research team to collect spinal fluid. And this can be a really valuable way for people to contribute to ALS research. I mentioned also that there's some remote visits. We've contracted with a phlebotomy company that we can actually send to people's home or another location if they would prefer, and actually draw blood in between these remote or in between the annual in-person study visits. And this is because we think this helps gather additional important information and decreases the burden of traveling to our study sites. Let's move on to the next slide. Um, So this type of study, which follows people who are at increased genetic risk for ALS, is not entirely new. There have been a number of kind of smaller studies, including the PREVENT study at the University of Miami, the DIAL study at Mass General and Washington University in St. Louis, which I helped run before in the past, as well as the ALS Families Project at Columbia. And these studies have all been following people with ALS genetic variants for many years. What is really new here is the scale of the PREVENT study. So in the past, we've seen research participants who've traveled from all across the country to take part in the pre-FALS and DIALS and families projects. A key goal has really been to make participating in PREVENT more accessible to people who live far away from these major academic centers. So as a result, the PREVENT study now includes over 30 research sites located all across the country, which makes it easier for people who are at genetic ALS or at genetic risk for ALS to find a study site that is within a reasonable travel distance from their home. By making this more accessible to individuals, we hope that we're going to be collecting much larger amounts of samples and data and putting them all in one central biorepository and data hub to help make all of this critical samples and data more accessible to researchers all around the world who are looking to develop treatments or cures for ALS or FTD. Next slide. This map really shows all of the all ALS clinical sites across the country. You can see there's a really big geographic spread. And so, our goal has been that if you're interested in participating, we can really help connect you with a site that's nearest to you. And Myah will talk a little bit more about what that process looks like later. Next slide. And just to show a little bit about our progress to date, so the PREVENT study has enrolled 134 individuals so far. 20 of those individuals have opted to enroll in an optional sub-study called the Genetic Testing Results Sub-Study, in which the participants meet with a genetic counselor to learn all about the risks and possible benefits of doing genetic testing to learn if they carry ALS genes. And those 20 individuals have kind of opted to kind of go through that process. That obviously looks like a little bit of a small number, but that's actually because likely many of these 134 people who are participating have already undergone genetic testing before in the past and already know whether or not they carry one of these ALS gene mutations. In addition, on the top, you can see our numbers, our enrollment numbers for the ASSESS study. So we're really excited that so far 133 people who are living with ALS have joined the ASSESS study as kind of symptomatic on-site participants, and 60 individuals have joined our remote cohort where they have entirely remote participation in the ASSESS All ALS study. In addition, we've seen that 63 healthy individuals who don't have ALS have opted to join the study as controls, which again can be a really great way for people's friends and family members to support those who are currently living with the disease. Next slide. And this study shows a little bit about, the progress of the all ALS research study so far. So on the left side, you can see kind of the activation of our study sites. The orange bars are kind of what our goals were. The blue bars were where we're actually at today. And you can see actually, looking at the little arrow that says 32 sites, we've activated a total of 32 sites for the all ALS study, which is actually surpassing our goals that we had set, which is really amazing. And we're really excited because I think this will make a big difference for ALS research. On the right side, you can see the number of patients who are enrolled across both the ASSESS and the PREVENT study. You can see that in total, there's been 405 participants who enrolled across the two studies. And the orange line is kind of what we were kind of hoping for and forecasting for enrollment for the study. And you can see those are essentially near identical. So we're right on track with what have been some very ambitious goals for the research study. Now I really wanted to turn things over to Myah, who's our patient navigator over at Barrow, to talk a little bit about how people can learn more about the all ALS studies, including PREVENT, and how to consider enrolling if they're interested. So Myah, do you want to take it from here?
Yes. Thank you, Dr. Gray. Thank you for that wonderful overview of the study. So as he stated, my name is Myah. I'm one of the patient navigators. We have another patient navigator. Her name's Emma Allen, and we are going to be the best points of contact for anyone that's interested in participating in both PREVENT and ASSESS. I think we can go to the next slide. Yeah, there we go. So a little bit about our website. Our website houses a lot of the information discussed by Dr. Garret. We have a link to the website and QR code listed at the top, but our website also shows the study progress. We also have something called the participant interest form listed on our website, which I will discuss in a little bit. We also have links to our webinars on our website, previous webinars as well, in case you want to get some more information about all ALS. And then we also have a cool feature on our website. It's the map of all of our activated sites. So this will just show you any of the activated sites that we have right now for each of the studies, as well as the contact information for each of the study coordinators. So this is going to be one of the ways that you can get in contact to participate in all ALS through contacting the study coordinator directly. But if that's something that you don't want to do, we also have the participant interest form, which is going to be located on the participate page of the website. And this form just takes you to a survey that asks some basic information like contact information and location, so that me or Emma can reach out to you to either discuss the study further or help you get in contact with one of our activated sites. We can also set up calls as well as once we reach out to you through email, if that's a better avenue of communication for you, and we can have a more in-depth conversation about the study. Next slide. So these are just some more ways for how to get in contact for all ALS. So as mentioned, the website is going to be a really good way to get in contact. It has the avenue to reach out to the patient navigation team, as well as information for all of the study coordinators. Clinicaltrials.gov also houses the information for the study coordinators for each of our studies, both assess and prevent. You can also find information at the NEALS Trial Finder, and as well, you can email all ALS patient navigation team directly at info@all-als.org. So that if you email that inbox, that'll come directly to either me or Emma, and we will reach out to you kind of with the same process. We will collect some more information, answer any questions that you may have, and again, we can schedule a phone call to discuss the study more in depth. Once we come to a decision about whether or not you're interested in participating in the study, we can then refer you to a site that's either going to be closest to you if you're going on site, or we can refer you to a site that's accepting remote participants. And I think that's all. We're going to stop talking now and open the floor for questions, but thank you all so much for listening.
Yeah, I think that's absolutely great, Myah. Yeah.
Thank you both, for sharing that information. And there is a question in the chat that I was going to pose to you. So someone's asking, could you articulate on preventative interventions?
Yeah, I think this is something that obviously a lot of members in the ALS community are really interested in right now. And I think it's something that unfortunately has been really challenging to study. I mean, one of the difficulties in ALS is it has a very unpredictable kind of age of onset across, potentially decades. So it's hard for us to evaluate how preventative treatments may be beneficial. So I can talk a little bit about one preventative treatment that's being looked at right now for a specific genetic subtype of ALS called SOD1 ALS. So in that trial, or in that, people with that particular type of genetic variant, it's actually been shown from a trial very like PREVENT that there's a marker called neurofilament light chain that starts to elevate a little before someone develops ALS, potentially by 6 to 12 months. And so in the case of SOD1, we have a treatment called tofersen that has been shown to slow progression in people who already have the disease. And so there's an ongoing trial that's looking at treating people who carry SOD1 gene mutations, who then develop a rise in this neurofilament light chain marker, and basically treating them with tofersen to see if that delays the time it takes for them to get ALS. So that's obviously specific for this one specific genetic subtype of ALS, but maybe an example of how we're looking to build trials in the future. Now, I think there's a separate question of, say you carry a C9 gene mutation or you carry an SOD1 gene mutation, what is it that you can do to, maybe reduce someone's risk of developing ALS? And I think that's still something that we're still working out, unfortunately. So there's been a lot of interest in a variety of supplements. And what I would encourage people to do really is kind of talk to, their doctors, if they are working with an ALS specialist or they're seeing an ALS specialist through the course of PREVENT to kind of get their opinion on what options might be right for them.
Speaking of other studies, somebody is asking, there are other studies going on in this space. Will that data be consolidated? It seems like sometimes there's some redundancies in the types of studies in ALS.
Yeah, I think it's a challenge, and I think it is something where we try to be very cautious that we're not kind of overburdening, the kind of ALS gene carrier community with asking them to participate in too many studies. This is a motivated group. Um, Unfortunately, sometimes our ability to share data across studies is limited by, the way our informed consent forms are written, limited by institutional policies or kind of what we call it institutional review boards that govern research and make sure that we protect the safety and confidentiality of individuals participating. So the way at least all ALS is designed is that there will be kind of a centralized data portal as well as samples that essentially different researchers can apply to and be granted access to help with individual data projects. And our hope is that we'll avoid some of the duplication of efforts that has occurred before in the past. But I think it doesn't entirely eliminate it if you're someone who's trying to kind of participate in multiple, different research studies. But it is a challenge that we're running into, and we try to address. One question that I've been asked a lot for PREVENT is, we have a number of people who've participated in prior studies for ALS gene carriers, like the DIAL study or the ALS Families Project. And our goal is really that we're working to really ensure that the data from those two studies or from those studies is kind of linked, and that we'll be able to kind of eventually combine them into one larger data set.
And somebody's asking if you have any comment on whether there might be threats to budgets due to all that's occurring in Washington.
Yeah, I mean, it's a hard thing to really comment on. So we haven't heard of anything specific for all ALS, and so far, the federal government has been kind of very supportive of ALS research. It's something that I know our research team is really monitoring very closely, but nothing so far.
Going back to some of the discussion about NFL as a biomarker, someone's asking, at what point do you believe we'll call NFL a biomarker for ALS?
Yeah, so I think NFL is already a biomarker for ALS. So the term biomarker really means, basically something measurable that we can that informs us about a disease. And so what we know about NFL for ALS as a whole, so is that in general, NFL or people who are living with ALS already typically have higher levels of neurofilament light chain compared to healthy individuals who do not have a neurologic disease. And within the people who have ALS, those who have the highest levels of NFL elevation, they typically experience a more rapid kind of progression of the symptoms of ALS. And as a result of that, a lot of the companies that design medications, to potentially treat ALS are really looking at NFL as a way to gauge the effectiveness of, new experimental medications. So, and we've already seen that this has had a big impact on drug approvals in ALS. So the medication tofersen for SOD1 ALS was really approved largely on the basis of, really significant decreases in NFL after treatment. And we've seen over time that seems to be associated with kind of slower disease progression and prolonged survival. Now, there can be other ways in which we can use biomarkers. So I talked a little bit about for people who have ALS gene mutations but don't have ALS right now, that it may be a way we might monitor or potentially predict when someone might get ALS. I think understandably we're all excited about anything that can give us information about that. But there are a couple caveats. So one is that data has almost entirely been from people who have real rapidly progressive forms of ALS with SOD1 gene mutations. And so it's not necessarily applicable to every single person who carries an ALS gene mutation. We see ALS patients who definitely have disease who sometimes have normal NFL values. And so, again, this may not be a perfect test for every person. another challenge with NFL is that it is not specific to ALS. It's a pretty non-specific marker of nerve injury. And so if someone has a concussion or a fall, it can sometimes increase NFL in a transient fashion. And so I think all of us are trying to grapple with exactly how to use this in clinical practice and in a research setting. And I think we're growing a lot more familiar with it. And I think I see a lot more ALS clinicians using it regularly in the clinical sphere.
This question, it wasn't submitted in the chat box, but I received an email from a family who they were specifically asking in the context of, their family is impacted by ataxin-2 and ALS. So they were asking, what information could you share with families who, have that type of circumstances? Prevent All ALS a suitable study, or kind of what would your recommendations be there?
Yeah, it's a great question. So just, for everyone else listening, so I've talked a little bit about C9 and SOD1 gene mutations, which over someone's lifetime, someone who carries one of those gene mutations has a very high risk of developing ALS. So for SOD1, about 90% of people who, carry those gene mutations will eventually, develop ALS. There can be some variation in that number depending on exactly what SOD1 gene mutation you have. The ataxin-2 gene is what's called a repeat expansion in the ataxin-2 protein. And what we see is that people who have a higher than expected numbers of repeats within that gene, they have an elevated risk of ALS, but it's a lot lower than what we see for, say, SOD1. So depending on the exact length of the repeat expansion, someone's risk of developing ALS may increase by about 1.5 times to up to about 6 times the normal population risk of developing ALS. So the normal population risk of developing ALS is somewhere around, 1 in 400 people get this disease over the course of their lifetime. And so if you multiply that by, say, 3 times, someone who carries an ataxin-2 gene mutation might have about a 1 in 100 risk of developing ALS. So a lot lower than for SOD1. So PREVENT does allow people who have ataxin-2 gene repeats above a certain length, so in this case, kind of 31 repeats, to participate. So what I would say is, for your family, if you kind of carry this, gene mutation or wondering if all ALS would be the right study for you, go ahead and reach out to kind of Myah or one of our patient navigators using the approaches we talked about. And basically, there's a way that the investigators here can kind of help evaluate whether it looks like your family's gene mutation would be a good fit. And so we're happy to kind of talk with you more about that if there are specific questions about eligibility.
There's a fire drill happening in my office building, so I will put myself on mute. I don't know if you see the flashing. Nobody worry about me. I'm fine. It's a drill, but I will hand it over to you, Myah and Mark, to wrap things up tonight.
Perfect. That sounds great. Want to make sure you're safe, Catherine.
And I don't think I see any other questions coming through the chat, but
Yeah,
like we had stated, as the patient navigator, my position is to help you and get connected with the sites, and we want to be able to provide you all the information that we can. So even if it's just a quick question, please feel free to email us. I am always going to be answering that email inbox every day, so you should receive a pretty quick response time from me, and we can schedule a call to discuss more. And yeah, I just want to be there to help any of you any way I can.
And then I guess, Mike, would you talk about maybe what the timeline that we kind of expect after you've kind of reached out before we, get back to people and before they might be connected with a site?
Absolutely. So every time the participant interest form is submitted, that does trigger a notification in my email inbox. So you will receive response within 3 days. That is kind of the standard that our patient navigation team has set. Once we refer you to the site, it does take them sometime between 1 to 7 days, usually closer to the one side of it. So the sites are pretty quick about responding to participants, but so it should be a quick turnaround time. But we do want to collect as much information from you as we can, because we don't want to refer you if this isn't something that you're going to be interested in. So we do really want to promote those conversations that you can have with me or Emma from the patient navigation team to kind of discuss the study further and understand all the requirements before we refer you to the site.
Yeah. And I'll just say, as a site investigator myself, I'm really so thankful for all the work that you're doing to kind of help make, connect people with the right sites. I think it really makes a big difference.
Yeah, and we don't expect the decision right away. I know it's a big decision to be a part of any study that's going on. So if you reach out to us and then you want to reach out to us again in a couple months later, that is totally fine. It's all on your timeline is how we want to work with this. We just want to be there to support you in any way we can.
I think that's exactly right. And that comes not just from you, but also, again, if you're connecting with a particular all ALS research site, we really do expect that the team there should be able to kind of answer all of your questions about participating and really help you make, the best informed decision that's right for you or right for your family members. Perfect. Well, thank you everyone for joining. Do we see any more questions here? I see one from they were asking about a drug called FB1006 by 4B Technologies. So I have to say that I don't know about that drug in particular, so I do apologize, but I wouldn't be able to give you kind of an informed answer off the cuff. I'm happy if kind of Catherine has, I don't know if Catherine has your contact information to that participant, but happy to follow up offline about that afterwards.
Yes, I do. I think I have that individual's email address. And I will say for a lot of these webinars, our guest speakers know a lot about a lot, but for certain, if there's industry or drug company specific questions, I typically suggest going directly to that drug company's website, and they typically have some sort of pathway for people to reach out. And they would definitely have the most up-to-date, accurate information on their drug development pipeline. So I'll put that tip in there because I'm not aware of that investigational product.
Perfect. Yeah, thanks so much, Catherine. It's always an important question, and there's a lot of research going on, which is always exciting, but it's hard for us to be experts on absolutely every single one.
But with that, I do think we got to all the questions in the chat.
Great.
I think one more thing came in here. Somebody asking about NFL. So I don't know if you want to sign off with a quick recap of your takeaway message on NFL.
Yeah, so I mean, I think the takeaway message for NFL is I think it's become an increasingly important test for people who have ALS that many physicians are using to help inform prognosis and kind of how rapidly we might expect the disease to progress. It's being used all the time now in clinical trials as a way to assess whether medication is helping ALS, and it may have benefit potentially in monitoring people who carry ALS gene mutations and may be genetically at risk for developing disease. But that is still definitely much more of a work in progress at this point. If you have any questions, though, I definitely encourage you to kind of talk with, a local neurologist or an ALS specialist who you may be working with.
We are at 5:35, so I want to thank you, Dr. Gray and Myah, for your time and sharing information at this webinar. And I will follow up with, if there's any questions that are trickling in, I'll generate a report and I'll reach out to anybody to make sure that you get a response. So thank you again for being here tonight. Thank you to our audience for being part of the conversation about ALS research. And we'll see you next webinar is an expanded access webinar on May 8th. So we'll see you in a couple of weeks for those who want to attend that one.